Medical revalidation of Puerto Rico. Clinical vignette on Aldicarb poisoning. Clinical vignette. A 35-year-old farmer is brought to the emergency department after being found unconscious in his field. His wife states that he was spraying pesticides earlier in the day and began sweating profusely, vomiting, and having difficulty breathing. She also noticed muscle twitching and excessive salivation. On examination, vital signs: BP 90 60 mmHg, HR 40 BPM, RR 10 min, SpO2 80%. Physical exam: pinpoint pupils, meiosis, muscle fasciculations, bronchospasms, bradycardia, and copious oral secretions. Neurological exam: decreased consciousness, respiratory depression. Shortly after arrival, he goes into respiratory failure and requires intubation. Question: what is the primary mechanism by which aldicarb poisoning leads to death? A. Inhibition of acetylcholinesterase, cholinergic crisis. B. Blockage of muscarinic receptors, sympathetic overdrive. C. Disruption of mitochondrial oxidative phosphorylation, ATP depletion. D. Inhibition of sodium channels, cardiac arrest. Correct answer: A. Inhibition of acetylcholinesterase, cholinergic crisis. Aldicarb poisoning. Mechanism and symptoms leading to death. Aldicarb is a carbamate pesticide that functions as a reversible acetylcholinesterase inhibitor, leading to excessive acetylcholine (ACH) accumulation at muscarinic and nicotinic receptors, causing a cholinergic crisis. Symptoms leading to death. Less sludge killer bees. 1. Muscarinic effect, sludge syndrome. L. Lacrimation, tearing, urination, diarrhea, gastrointestinal cramping, emesis, vomiting. 2. Killer bees, severe life-threatening symptoms. B. Bronchospasm, respiratory failure, leading cause of death. Bradycardia, severe hypotension, cardiac arrest. Rhonchorea, excessive lung secretions causing asphyxiation. 3. Nicotinic effects, muscle fasciculations, weakness, paralysis, can progress to diaphragmatic paralysis. Seizures, confusion, coma. Explanation of death mechanism. Death occurs rapidly due to respiratory failure from bronchospasm, excessive secretions, bronchorea, and diaphragmatic paralysis. Severe bradycardia and hypotension can also contribute to cardiovascular collapse. Treatment, antidote, and supportive care. Atropine blocks muscarinic effects, reduces secretions, reverses bradycardia. Pralidoxime, 2-PAM, reverses nicotinic effects, muscle paralysis, effective for organophosphates, but less so for carbamates, oxygen and mechanical ventilation, support respiratory failure. Would you like a flowchart or diagram to illustrate this poisoning pathway?